So in today's world, we can't hear enough in the news about the opiate crisis. And thankfully, there's been a lot of really positive things done about it. But a lot of times I'll get patients that come in that have severe injuries that we might have to put them on opiates, but they're terrified about getting stuck on them. But the reality is, if you're motivated to come off of these medications, you really can come off of them gradually without going into withdrawal and without developing a full-blown addiction. So the media out there makes you think that if you take one of these medications, you're going to be stuck on them forever, you're going to sell your family and lose your job. That's just not the case. If you're a motivated individual that doesn't have significant socioeconomic problems, doesn't have mental illness, doesn't have profound addiction, you can take these medications safely and then wean off them slowly without going into full-blown withdrawal. Now, I'm not saying that this is something you should look for, but a lot of times people can't take Tylenol because of their liver, they can't take NSAIDs because of their gut, or they have a heart stent, and they have to go on these medications transiently. So if this is the case, I would talk with your doctor and say, hey, I'm worried about getting stuck on this stuff. What's the plan for where I'm going to be today and how I can come off this stuff? And then when patients ask us, how can I come off this stuff, we'll typically tell them, drop it by a dosage every 3 to 4 days. That's going to allow your body to create its own endorphins and prevent withdrawal and allow you to have a smooth transition off these medications. Of course, you're going to talk to your doctor more about this. There's also some other medications we can give you to help with some of the slight withdrawal symptoms. Maybe you're having sleep issues. Maybe you feel a little anxious. There's non-opiate medications that we can prescribe, and we'll have that conversation with you, with your physician. But again, if you're worried about taking these medications and be addicted for life, that's not the norm. Most people can come off easily, and the way to make sure this happens, if you're going to have a surgery or procedure, is have a plan with your physician before you even have the procedure done. Have them delineate, you're taking this many today, this many tomorrow, and by day 10 to 14, whatever that day is, we're going to be off them completely, and I guarantee you can come off smoothly. Hope you found this useful and look forward to talking to you next time.